right. Hey, whoa.
Hey,
What is this guy doing here?
Dr. Pichapoli. What's up, man?
How did he get in here?
I don't know. I don't know who let him in. Jeez.
How did you get in here? What's going on?
I got the Burrow calf, Doc. I made an appointment with the girls up front. And I also went on your website. I can book an appointment right there.
Burrow? What's a Burrow calf?
I got, the Burrow thing. I got a game on Monday. I want to know if I can play.
Joe Burrow?
Yeah, I got the same thing.
By the way, he's on my fantasy team. He's not scoring many points for me.
I got the same thing on a calf. You think I can play on Monday? I don't want to get the Rodgers calf.
All right, so there's a difference. That's right. So Rodgers is the Achilles tendon that tore. Okay, right here. Like my football socks, by the way. Joe Burrow, I'm assuming, is his calf. It's the muscle, okay? Actually, we got a patient who just had a calf injury, a quarterback, by the way, and he tore his calf muscle. There's a gastroc, which is on closer to the surface, and then deep to that, there's the soleus. So there's two different muscles in your calf. They come down, they form a tendon that goes to your heel bone here, and when you contract these muscles, you're able to push down, okay? So obviously, if you tear the Aaron Rodgers Achilles tear, you can't push down, can't run, he'll slice the ball every time. And then if you have a calf injury, you can't push off when you're throwing. So if you notice, Joe Burrow's not really accurate with his passing because he's got that tear. Here, I'll show you. I got a MRI I can show you, but I don't know how you got in here. But either way, I'll show you, and then we'll see. Maybe we'll get an MRI on your calf and see if you got the same thing. But this is somebody that we actually just saw recently. This is kind of a front view MRI. This is a side view, and this is cutting across, kind of like this, okay? So this is the front of the leg. This is the back, the calf area. These are bones. There's two bones, your tibia and your fibula. And in the back here is your calf muscle, okay? So muscle is kind of grayish, blackish on an MRI. Anything that's white is fluid. So this person tore between the two areas here of that muscle, and it filled in with a bunch of blood. Blood is fluid. And so that's the tear actually right there. We have an ultrasound image, which I'll show you in a second.
All right, yeah, Dr. Petra, I think I got that. I got the Burrow thing that you showed me. What do I do? What can we do? I want to be able to play on Monday. Can I play on Monday or not?
Well, we'll get the MRI on you and we'll see. Okay, maybe. I don't know if I want to treat you, but anyway, this is an ultrasound. An ultrasound, which we have right here, is basically like sound waves, and we're able to look using sound waves, not any radiation, into the calf area and see if there's a tear there. So on an ultrasound, the fluid's going to be black as opposed to what you saw in the MRI where it's white. So the muscle is here and here, looks kind of like muscle, right? But there's been a tear and this is all filled in with fluid. So what we can do is we can use something called PRP, platelet-rich plasma. We can take your own blood, spin it down, get the platelets out. The platelets are those things when you cut yourself, you form a scab, they stop the bleeding, but they also have growth factors and they release those growth factors, and those growth factors stimulate new blood vessels and cells to come in the area, which helps with healing. So we do numb the skin up. This is actually a needle right here. You can see this right here going into the area where the tear was. And then what we did was we injected, you can see this is all fluid here, and then you can see how it turned kind of whitish. That's the PRP filling in that area where that defect is, and there's the needle right there. And then also the muscle had tearing in it, so that's the fluid collection, and this is the muscle right here. You see normal muscle looks like meat, but this is all torn up and shredded like hamburger. So we stuck the needle in here and filled that in. You can see this white area as the fluid's going in and filling that area, and we filled in the entire area where that tear was, and that's going to help it heal faster. So that's what Joe Burrow needs, by the way. He needs to get some PRP. We're going to use laser therapy as well. We have a lot of videos on that. But I have other patients to see right now, and I'm not sure how you got in here.
But one more question, Doc. If the Joe Burrow, or if I get the PRP, can I play on Monday?
You can't play on Monday, no. It's going to speed things up, maybe 2 or 3 weeks, 4 weeks, it depends. But it still takes any injury like this about 3 weeks to 3 months to fully get better. The PRP and the laser will speed that up.
All right, thanks, Doc. Appreciate your time, man.
You're welcome.